Every challenge has its roots in health, and it's my job as the Commissioner of Health in the city to let our citizens, our elected officials, and our business and other sector leaders know that they have to think about everything as health. So if they care about education, if our children aren't healthy, if they're facing huge unmet health needs, how can they learn in school? If they care about crime, understanding that the most important investment is not in punishment and incarceration, but actually going far upstream and instead talking about how can we invest in our children's health. That's the conversation that we are fostering in the city. And that's the conversation that's so important to get all of our partners to the table in a way that really moves the needle on key health metrics. But it is about investing as early as possible, going to where people are on the ground and looking at everything as a health issue. The biggest issue facing our city is poverty. We are a majority minority city. We have concentrated poverty as a result of people leaving the city. And as a result, we have to look at poverty as a health issue. We have to look at violence as a health issue. We have to look at our systemic problems, our policies of racism and discriminatory housing practices as a health problem. And so it works both ways, that we have to invest in improving the economics of the city, but also understanding that what underlies it is poor health. We have three key strategies to improving health in Baltimore City. The first is that we go to where people are. We hire individuals who are from the communities that they serve because they are the most credible messengers. They're the ones who teach our new moms about infant mortality prevention, safe sleep practices, about violence prevention efforts. We believe in going to where they are instead of having them come to us. The second is we believe in cross-sectoral collaboration because everything ties into health. We also have to make sure that we have partners in the police and education, nonprofit, our business partners around the table. The third is that we define our long-term goals but have short-term metrics that the community and all of our partners can hold us accountable to, can hold each other accountable to. That's how we're addressing these systemic root causes of problems in Baltimore City. Tackling this issue requires an understanding that everybody does have a legitimate interest in this. Businesses, residents, schools do have a legitimate interest, but their interest is not ensuring that there's no clinic there. Their interest is ensuring that there's safety or that there's a standard of living that's necessary. And so for us, on the treatment side, we need to make sure that there are good neighbor agreements that all parties agree to, that there are codes of conduct that everybody agrees to, but we also have to have shared values as the basis. And that shared value is that addiction is a disease, that recovery is possible, that treatment exists, and that treatment actually increases not only the health, but also the economics of that neighborhood and reduces crime. And also, ultimately, that it's a matter of saving lives, and all of us are in this together. I can give you two examples to choose from in terms of how we have moved the needle and enlisted our community in these efforts. The first is infant mortality. Back in 2009, Baltimore had one of the worst infant mortality rates in the US. Our babies were dying at the same rates as babies born in the middle of civil war in other countries, as a result of a program called Be More for Healthy Babies that was led by the health department, but that involves partners, over 150 partners from across the city. We have been able to reduce our infant mortality rate by 25%, reduce the disparity between Black and white infant deaths by 40%, and a 50% reduction in sleep-related infant deaths. So this has really significantly moved the metric within just 4 years of the program starting. That's a great example for us of why collaboration matters, but also why having one common goal is so important, and one common strategy is so important. Second example is around overdose. We have more people dying in the city last year from overdose, drug overdose, than died from homicide or suicide or car accident, which is a trend that is mirrored throughout the country. We have been able to use a multi-pronged approach to address this issue, including passing legislation to allow for blanket prescription. So I am now the prescriber for the antidote medication, naloxone, for all 620,000 residents of our city. We've also been able to do hotspotting and target people where they are, going to markets, going to shooting alleys, going to through our needle exchange vans to really address the issue with the people who are the most affected. And the third is, again, enlisting all of our partners in this effort, having one citywide strategy and having everyone who works on addiction, whether they're hospital providers, whether they're schools, whether they are city agencies, work together with us and buy into this one strategy.